Stanford to go to SMOC. We'll be taking Embarcadero Road to 101 to get there. So here we are turning from El Camino to Embarcadero, making a left. We're getting on to 101 north from Embarcadero, heading to Redwood City. We're taking the Woodside exit from 101 north. Side exit and you stay in the left lane to go back over the freeway. At 430 Broadway. Address is 420 to 430 Broadway. You make a left and you pull in, and you can park anywhere on the surface lots. It goes all the way around. Okay, underground parking is hard to find. It's to the right of the loading docks where there's vans. You take a right and it says permit parking only, and you slide your badge in right down here to get in.
Welcome to Stanford Medicine Outpatient Center. I'm going to walk you up to the Outpatient Surgical Center. So you park your car in level A underground parking, and walk over here to the Pavilion A elevators. You have to use your security badge to use this elevator, as well as to enter into the garage. Alright, so when you come out of the elevators, you enter into the staff lounge area. Make just sort of a quick little L shape. And this is the staff lounge, which then takes you to the med and women's locker room. In the staff lounge, there's vending machines, microwave, refrigerator, coffee, filtered water. We have lunch served each day, comes up around 11:30. There's been lots and lots of food. There's also another set of vending machines downstairs on the first floor at the cafe that's open from 7:30 to 3. So the entrance to the locker room, women's locker room, men's locker room. We have 4 designated anesthesia lockers in each room. Alright, so when you leave the staff lounge, walk over this way and you'll enter into the pre-operative area, holding area, as well as the PACU. That's the entrance to the operating room, so we'll show you that in a second. So this is one of the patient bays. This will serve us as a pre-op and a PACU area. Around the corner, we have a dedicated regional bay for doing regional blocks. It's a slightly wider bay and has an ultrasound machine there. In this area, the nurses will be starting the IVs and also be transporting the patients to the operating room to increase efficiency.
OSC, and I'm just going to kind of talk about the pre-op area and how we are doing it with the patient flow and for the anesthesiologist. As the patient comes in the door behind, they'll come up to this, through that door, get weighed here. The bays for the patients are here to the left. This is the pre-op station for the nurses. And then we're going to have the patients in the bays for the anesthesiologist. We are using the EPIC program. We'll be looking for your 23-hour updates in the EPIC. We are also going to be starting the IVs on your patients so that everything will be ready for you. You'll be able to come and see your patient in each of the individual bays. And then after you have seen your patient and you're ready to take the patient in the operating room, the circulators are going to be coming out, interviewing the patients, and they will be taking your patients from these bays this way around to the side, and then there's another hallway that goes all the way around, and that will be where you're going directly straight into the operating room. There's also the other hallway, if we continue down this way to bay number 8, there's another entrance that goes through the recovery room area of this kind of corner unit. So that is where the recovery room bays are, and those we're going to have, if there's patients there, we prefer to have the pre-op patients going to the OR. That's the first way I stated, going down the other hallway. As far as if you're doing regional blocks for the patients preoperatively, we have a separate bay here for that. We have the ultrasound machine, we have the block cart for you, monitors, a bigger space, so there's more room for you guys to do the regional blocks in, and then we'll have to keep the patient in that area until the patient is taken into the operating room. I think everything else is pretty much like it is in the main and in ASC, and if we're going to be of any help, just let us know.
So we're back at Station B. In the event of an unexpected PACU complication where a patient needed to be reintubated, reintubation equipment is reintubation equipment will be back over here right behind Nursing Station B, and Pyxis with emergency medicines is located just around the corner. We're right outside the double doors for the entrance into the operating rooms. Before we enter there, we just came out of the pre-PACU area. The code cart is located right before the double doors, as well as the employee therapy cart. As soon as we go through the double doors, just on the right side is the anesthesia workroom, which is where the difficult airway lives. The ORs are effectively a square shape. The ORs that have been built out primarily are the ones located onto the right. Control desk is just to the left as you enter into the space. Anesthesia workroom.
Just kidding.
Is 3 out there?
6 ORs have been built out with the potential for 6 more. Currently 4 are assigned for surgical cases. 1 is dedicated to the pain service and 1 is dedicated for endoscopies. The size of the room is about the size of one of the heart rooms at Stanford. All the equipment is comparable or upgraded compared to the ASC. We've tried to stock things in a similar manner to the ASC so that physicians working at both locations don't have difficulty finding anything. We do have wireless internet access here. The anesthesiologist will have wireless cell phones that they can use. All right, so we just came out of the ORs and walking down the hallway. PACU's behind us. Last thing I want to show you is the office space that I share. And whenever you're on call here or working here, feel free to use the desk space. Come here for any to relax. Snacks kept up there. Any questions, please feel free to always call me. The medical director number is 721-7053. Look forward to working with you at the Outpatient Center in Redwood City.